Today, many folks are hesitant to receive a vaccine or perhaps just can't access one, but the reasons why vary. In Vax Matters, we're going to explore that specific topic.
The question we're asking today is, why do so many people face barriers when it comes to getting a shot? And why do so many remain hesitant to get vaccines in the first place? The reasons may not be so obvious. Dr. Lacey Cavanaugh joins us to provide an expert's perspective. A regional medical director for the Louisiana Department of Health, Dr. Cavanaugh oversees the Office of Public Health's Region 5. Dr. Cavanaugh, it's so good to have you on the show today. How are you?
Hey, I'm doing well. Thanks for having me.
We're looking forward to a great conversation today, Dr. Cavanaugh. And I think what we want to do is to begin, obviously, at the beginning. Tell us about what some of the most common barriers might be to getting people vaccinated, Doctor.
Well, I do think there are quite a number of them. One that we've heard a lot lately is that people are very busy. Specifically this summer, folks are out and about and traveling and enjoying time that they haven't been able to do for a few years. So I think that's one thing that a lot of folks mention. Another thing that we see a lot, at least where I'm at, so I'm in Southwest Louisiana, we got hit by two major hurricanes over the last 2 years. And that has created a lot of work for folks in just fixing their homes and dealing with their insurance companies. And so there are just a lot of competing priorities that people have. And I think sometimes they feel too busy to stop and make time and to make health a priority, especially with the state of the economy right now. People are also very busy working, sometimes working multiple jobs, and sometimes it can be difficult for people to get off of work in order to prioritize their health, including getting vaccinated. So, those are all some. I also sometimes hear of cost being a barrier, not so much for COVID vaccine, but sometimes for other vaccines, cost can be a real barrier. Some patients are afraid for various reasons. They cite safety concerns. Sometimes they're afraid of needles. Sometimes they're afraid of doctors. And then we also are a pretty rural and remote area. And so a lot of people feel like access to a doctor's office or to a pharmacy is not easy because they have to travel a long way, or there's unreliable transportation, or there's a lack of primary care doctors. So those are probably some of the most common ones I hear.
So before we started the show today, there was probably about a 20-minute conversation in this room about needles and the fear thereof. And I won't get into all of the details about it, although it
was pretty graphic, Doctor. It was really
entertaining
graphic
to do so. But what about the fear of needles as one barrier people are facing and not getting vaccines or getting some of the various vaccines out there?
Well, I'll just say it's legitimate and it's real and it's relatively common. It is actually an officially recognized medical condition.
It is?
Yes, in order, phobias are common. People have phobias of all kinds of things. Needles are one of those, but people also more commonly, you might hear about phobias of getting on a plane or a phobia of a certain type of bug. So this is definitely real when folks have a phobia. I would encourage people to talk to their doctor because there are quite a number of options available for people who have a fear of needles.
Okay, let's talk through that. That's going to help a lot of people listening.
Sure. Well, I'll start by saying that some vaccines actually come in other forms beside from an actual shot. For example, flu vaccine can be given nasally, right? Rotavirus vaccine in children can be given orally. So there are other ways for some types of vaccine that people can receive it. So there may be an option depending on what vaccines a person might need. Another thing I'll say is that, especially for kids who are afraid of getting a vaccine, seeing trusted adults in their family or people that they trust, watching them can help to alleviate their fears when they realize that maybe it's not as bad as what they imagine. I mean, I've experienced this with my own children. I have 7 and a 9-year-old and taken them to the doctor to get their shots. They were very, very upset and concerned and crying because, of course they didn't want to. But then,
Right.
they saw me get my flu shot and they were like,
Ah.
oh, it's not that big of a deal. And actually now they're not afraid of vaccines at all after, seeing me and my husband receive vaccines. So,
I
yeah, go ahead.
no, I was just going to say, Dr. Cavanaugh, one of my earliest memories of getting shots. Okay, this is going to go back a ways because I'm probably the oldest one in this entire room, probably on the entire podcast, but nonetheless, I remember when I was a tiny little girl, petite, cute little girl, I might add. I was in the hospital. I had gotten my tonsils out. And I remember, distinct memories as probably a 5 or 6-year-old laying in the hospital bed and a nurse walking past my little hospital window with a tray that had 3 shots on it.
Yeah.
And I remember consciously saying, oh gosh, who's going to get those? And she turned into my hospital room, and I was the one getting the 3 shots. I thought, even as a child, it was just like a sheer terror.
You thought Michael Myers had
Oh
walked into the
my
room.
gosh, well, that was even before him. That was a long time ago. But my point being, things have changed a lot.
Yep.
As from when I was a little tiny, petite young girl, getting the 3 shots to where we are now. So much has changed. The understanding, the adults going before you, your family coming together, your friends doing it. You'd go all together to get your flu shot, or people come to your place of work to give your shots. It's a whole different conversation now. But I just kind of wanted to share that with you because that's my earliest memory of getting shots. The 3 on the tray that was supposed to walk past my window,
Yeah.
but the nurse turned into my room and they were for me. Not a very pleasant remembrance.
Well, it's interesting, Dr. Cavanaugh, that you say the fear of needles is a recognized phobia, which probably contributes to people not getting it. But do you believe that there are people who don't want it known that they have a fear, and maybe they say they're worried about some of the impact of the virus when in truth it's really more about the fear of needles?
Oh, yes, I absolutely think that can and probably does sometimes happen. But, for folks who are afraid of needles and, but who still, feel compelled to receive vaccines, there are other things we can do, especially, with adults. A lot of times just practicing deep breathing exercises. If you're in the doctor's office, sometimes if you're lying down, using distraction, can sometimes help. I've on occasion used even topical anesthetics,
Interesting.
for people before they've received a vaccine, like a lidocaine jelly or spray, which sometimes makes people feel more comfortable because sometimes it's not the needle they're afraid of, but they're afraid that it's
Yes.
going to hurt, right? The pain that comes with that, and that makes people feel better.
I've never heard of that
and
option before. I've never heard of that,
Yeah.
doctor. Wow.
We probably don't use it all that commonly across settings, but definitely I have used it before in conversations with patients. And, the other thing is in severe cases, there are even options for, taking a dose of an anti-anxiety medicine prior to receiving a vaccine or a procedure. We do that for a lot of other procedures, and we do that even for people sometimes to be able to get on a plane if they have a phobia of flying, right? You hear that sometimes they may take a little medication before. So that's also an option. So I would just encourage people, don't let that be a barrier. Talk to your doctor because there are some different ways that we could try to make people feel more comfortable. So.
And then after you get that shot, you get that cute little bandage with the smiley faces, and you're so proud of yourself that you've done it, Dr. Cavanaugh.
Yes, for sure. And, I will always say too with my kids, motivation, and,
Yes.
is always helpful.
The
So
smallest
I'll offer them an ice
motivation.
cream. Like if you're good for your shots, I'll give you an ice cream.
I like it.
Well, what about misinformation? I mean, we've done a number of these and have had conversations with medical doctors and people who are around the medical profession, and there's so much information out there, and not a lot of it is accurate. What impact is it having on people avoiding vaccinations?
Well, I definitely think misinformation is huge. And, A lot of that comes from trusting sources that are not necessarily reliable when it comes to medical care, right? Um, so I think that's one of the things that we really try to do is to provide people with where you can get reliable sources of medical information. And so a lot of times that includes talking with your own doctor, if you have a family doctor or a nurse practitioner or PA that you're familiar with, a nurse that you trust, a pharmacist that you trust. So getting your medical information from medical sources within the community is important, and not necessarily getting it from people that you don't know, especially on social media. I'll also say that, someone is not just going to trust you, especially if you're not listening to their concerns. So that's a conversation that I often have with providers in the community. Many of our physicians, will try to engage in talking with patients about vaccines, but don't necessarily fully listen to all of the concerns that they have, because we already sort of have our mind made up that the vaccine is helpful, right? And so I think it's really important that we listen to people's concerns, and that trust is built over time. It doesn't happen in a day. It doesn't happen in a week. It doesn't necessarily happen in a one-time conversation. And so, I really think that providing reliable sources of information and then building trust with people and really listening to their concerns can help us to sort of combat some of this.
And we've been talking about, too, over the course of forever, it seems like, Dr. Cavanaugh, that everybody is just weary of everything that's been going on, and that things change, that guidelines change, information changes. So there are constantly, it seems like, new questions that pop up that we want to address with our physician. And on our podcast before, we said there is no question too small, no question that's stupid. Just ask your doctor. That's what our healthcare professionals are there to do, to calm fears, to reassure, and to make certain that we're going on the right line for us to know what we need to do for our own health.
Absolutely. And, it definitely hasn't helped that guidelines in terms of who should be vaccinated and when and how often, they've changed a lot as we've learned. Although it seems like we've been dealing, for example, with COVID forever, it's only 3 years old. And compare that to, say, the flu that is hundreds of years old. We've had hundreds of years to learn about it and about how it works and how, all of the science behind it. And we've only had a relatively short time in the grand scheme of things to learn about COVID. So it has changed rapidly. And that's been, sort of part of the, I think, challenge in communicating why things change to people. And that's ongoing. Hopefully, I'm hopeful that some of those changes will start to settle down now that, we're a few years into this.
One of the things that comes up in this discussion is, and that's often left out actually, is people being able to get to the doctor. And if you live in an area like a Lake Charles or a Baton Rouge or a Shreveport where there's public transportation to get you there, I mean, that's one thing. But there are rural areas where people have difficulty getting to the doctor. And then there are people who are homebound. So why don't you speak to, Dr. Cavanaugh, the difficulty some people in our state are having even getting to see their physician?
I'll say that this is a real challenge, especially in a lot of rural areas where there are not as much access, as you said, to transportation and or medical care. Homebound is a little bit easier because we've really put a lot of effort with at least with COVID vaccines into making sure that we meet people where they are. And if they're not able to come out and receive a vaccine at a vaccine site or at a pharmacy or a clinic, or they can't get to their doctor's office, they can actually call our vaccine hotline, and we're able to hook them up with our team that goes out and is able to vaccinate people in their home. Although that's specific to COVID vaccines right now.
Oh, okay.
Getting other vaccines, for example, like a pneumonia vaccine in an elderly person who's homebound, is a little bit more of a challenge. I do know that, in some cases, home health agencies can be of assistance. A lot of times those homebound folks, even though they're homebound, they require medical care of some kind, whether it be someone coming to the home, or whether that be they manage to find a way to go to their doctor's office, once a quarter to receive their medicine refills and whatnot. And so, using those few opportunities when they are out of the house to try to make sure that we update their vaccines at that point in time, that way they don't have to make a special trip and go through this, twice. Some people also rely on public transportation or medical transportation. Medical transportation is available for a lot of citizens across the state. But it does come with barriers, which include, having to schedule that appointment in advance. Sometimes it takes all day for the medical transportation to pick you up, bring you to the doctor's office. It's quite a process. But it is available, and it is a way that a lot of people manage to make it to their medical appointments and get vaccinated. And so medical transportation is available to a degree for people who are seeking vaccination services, because that is a medical service as well. In rural areas, that is definitely hard. I'll tell you, our office has worked really hard to make sure that we have vaccine access in all of our parishes. Sometimes that's through partnerships with private providers and doctors' offices and pharmacies. Sometimes that's through our public health units. Sometimes we even do pop-up events where we offer a particular type of vaccine at fairs, festivals, places where people are already at. Actually, we had some of our staff from our office who were just at the Watermelon Festival in Beauregard.
I love it. Yes.
Just here recently, offering vaccines. So, I think sometimes in those rural areas, we have to go out and meet people where they're already at. So.
I know that recently I was at an antique show over in Round Top, Texas, and one of the huge venues they have there. What did they have out in front? But they had people doing vaccinations. At that point in time was COVID vaccinations. But again, what you were saying, meet the people where they are. And I know that here in East Baton Rouge, the East Baton Rouge Parish Council on Aging, they do a fabulous job
Absolutely,
of meeting people where they are. And I'm going to just say this. I'm sure that if listeners this morning have any questions about vaccines, or maybe somebody coming out to their house or getting transportation to doctors, that they could call any one of our Council on Aging. And if they don't have the answer, they'll find it out for you.
Yeah.
They will find out what you need to know, because they are a huge asset to our communities. I'm sure that Council on Agings across the state would be, Dr. Cavanaugh.
Absolutely. And we work pretty closely with our councils on aging
Yes.
across this region as well. So absolutely, they are a wonderful resource. And there are lots of great resources, in our communities that can really help to direct folks as well.
Well, to that point, before Di's next question, you mentioned pop-up events that you do around the state. Is there any resource people should know about to find out if one's going to be popping up near them?
Well, I will say people can call our vaccine hotline, and that can usually direct them if there's going to be an event in their area. But also, I would also encourage that if people have not had access and there's, a need to have a pop-up event in their community. I know at least at our local level, our office would be very happy to hear about what that need is and see if we can meet it, and go out and provide a vaccine event especially if it's somewhere we haven't been.
And missing work, that seems to likely be pretty high on that priority, when you said that sometimes we don't, our own health care ranks down in the bottom. But some people, you've got the hourly workers, you've got the day laborers, et cetera. Dr. Cavanaugh, they can't miss work. That more than likely is also a barrier to getting people vaccinated, or at least getting them vaccinated in a timely manner.
Absolutely. That is a challenge. We definitely have tried to work closely with employers to encourage employers to allow time for people to go and get vaccinated. I think most employers recognize that if their workforce is healthy, that they'll have, better productivity, and that, vaccination is one of the ways to stay healthy. So I think a lot of employers are probably supportive, but maybe don't necessarily realize that, they need to give an hour for this particular person off so they can go run and get their vaccine. So, I would encourage people to talk to their employer and see if their employer might have a policy in place. I know a lot of people do have policies in place that allow employees time off to go and seek medical care or to be vaccinated. But also, I know at least here we've worked with a lot of employers to actually bring vaccines to the workplace in order to try to mitigate that and, encourage vaccine events at employers' offices for wellness, The other thing is I do often see workers, especially those who may work in outdoor conditions or weather related. If you happen to work in a construction job and you get a rain day, finding a site that has vaccines, putting it on your to-do list. And when a day comes that it rains and you can't work, try to make it a priority for that day. If you kind of do the research before and sort of know who takes walk-ins, so you don't have to worry about the appointment scheduling barrier. We do see that sometimes. Sometimes we get a lot of walk-ins for vaccines on rain days. So
That's interesting. But what about single employee or single person businesses, a small business owner who doesn't have anyone who can fill in for he or she at their job, or someone who, like, we have a lot of lawn companies out there that are just a couple people who are out doing the work. That could be a bit more difficult for them. What's your encouragement to them about not letting that be a barrier?
I will say there are probably a number of sites that would provide after hours or weekend, vaccinations. But it's definitely difficult, and I understand that. But I also know that if it's that important for you to be up and functioning and at work, then that's even more important that person makes it a priority to get vaccinated. Because if you get COVID and you're sick and you wind up in the hospital, then you might be off work for even a longer period of time,
Right.
trying to recover, or have long COVID and have really difficulty sustaining operations at that point. So, sometimes it is a little bit of a sacrifice to take an hour off and make it a priority when you feel like you have competing priorities and you don't have time to do it. But at the same time, think about what happens if you choose not to because you don't make it a priority. It could be even worse. So I just encourage folks to think about both sides of that coin.
And another topic in the same discussion here about the cost, maybe the cost of some vaccines. Now, we know the COVID-19, we know that that's been free, to everyone in the country. But what about some of the other vaccines? Some of them are, kind of pricey. You were talking just a moment ago about like the pneumonia vaccine or the shingles vaccine, or what is it? The DTaP, I think that's another vaccine for adults. That can be concerning for some families who are really on a tight budget. What are your thoughts on that, Doctor?
Well, I would say absolutely. Cost has historically been somewhat of an issue for some vaccines. However, the good news is that when healthcare reform happened a few years ago, vaccines are almost, at this point in time, universally covered on most people's insurance. There may be some small charges in terms of like an administration charge to actually give the vaccine, but for the most part, insurance companies are pretty good about covering a broad spectrum of vaccines now. So we've made a lot of progress with that, say, over the last 10 years. But there are still some people and or groups that cost is and can be a barrier. For children, the coverage for uninsured and underinsured vaccines is a little bit more broad than for adults. One thing is health units across the state can actually provide low-cost vaccines for uninsured and underinsured people. And there are, barriers that come with that as well. But for the most part, that is a resource for people. For children, though, in addition to being able to come to health units for low-cost vaccines, we also have a Vaccines for Children program across the state which are private providers' offices like pediatricians' offices, family doctors' offices, rural health clinics, FQHCs. And through this Vaccines for Children program, the clinics can receive and give vaccines for children that are at reduced cost. There's also Shots for Tots, which also offers a sort of a similar model. So there definitely is access, even for people who say don't have insurance, or if their insurance at this point is still not covering vaccines. So we've definitely come a long way there.
Well, obviously here on this program and you there we're supportive of being vaccinated, and it's important to get us to the other side of what we're dealing with COVID. And I'd like you to speak to that for people who really want to get past all of what we're dealing with, whether it's COVID or some other a virus or disease or whatever. Being vaccinated helps us get to the other side of this a bit faster, does it not?
Absolutely. I mean, look back in history. 100 years ago, infectious diseases were one of the leading causes of death in people. And as vaccines started to become available for some of those leading infectious diseases, like measles and mumps, like Haemophilus influenza, as we developed vaccines for some of these diseases, our life expectancy as a population increased dramatically over time. Most people, I would say, in our current generation don't even remember a time when we had people dying due to infectious diseases that are now pretty much eradicated. Until COVID, we didn't really have experience with that. So, I mean, historically, if we really look at vaccines, they are one of the things that really have changed our course as a population in terms of allowing us to live longer, healthier lives without all the complications of those infectious diseases that we once lived with and dealt with. So, vaccines historically have been extremely effective. Right now, it is sort of a difficult conversation to have about vaccines because people, do have a lot of fears, and, it's hard to encourage people to get vaccinated when they have concerns but I just encourage people, whenever I have this conversation with people, I always talk about the historical value of vaccines and look how far we've come compared to, say, 100 years ago. It is the path forward. It is how we keep ourselves healthy. And the alternative, although sometimes we feel scared, the alternative, which is, all of those infectious diseases that we've eradicated being present in our population and running around again, that is even a scarier picture to me than all of the uncertainty and unknowns that people bring up with vaccines.
And I believe, Doctor, too, that sometimes, like a lot of times, we take our health for granted. We've taken the vaccines that we got as a child that was routine. We take, when we go as adults into our doctors, they look at our chart. Oh, you need this vaccine, you need this or that, just an upgrade. Or as you age, you need the shingles vaccine. This is what we have to do 2 of them, and new things always coming out. And I think that I don't believe that we're lax to a degree, but I believe that we've done so well for so long that our world blew up with COVID. And now when you hear the word vaccine, you don't necessarily think of all the other chicken pox and mumps and measles and the vaccines that are routine. Everybody thinks of COVID, and it's been a challenging 2 or 3 years. And we all need to be on the forefront. We need to talk about, about prevention versus treatment in this situation.
Right, absolutely. And, we've gotten used to a medical system that really focuses on treatment, that focuses on go in whenever you're sick. But I think sometimes we miss how much value there is in not looking at things from a disease model of how do we address this illness, but how do we prevent it from occurring? How do we focus on wellness instead of disease as our center point?
Wow. I want to kind of put a bow on this because I know that you had the opportunity to talk with patients and colleagues about this hesitancy that people have for getting the vaccine. Is there anything we didn't cover or any advice you would give to listeners to help them get to the other side of their fears?
I guess the last pieces of advice that I have for folks is, talk to trusted people, build trusted relationships with medical providers, recognizing that those conversations are going to happen over time, being non-judgmental, whatever side of the fence you're on, being non-judgmental about the other side and listening to, people's concerns. Acknowledging that we don't know everything, but really looking carefully at what we do know.
And we're all just trying to do what is best for ourselves, for our friends and family, for our community.
Right.
We want our community to be safer, and we need to do it one by one, Clay. We need to stand together and do it one by one so we can get, as we've been talking about on previous podcasts, so we can get over the hill, so we can be on the downside of all this.
That's right. That's right. Dr. Cavanaugh, thank you so much for all of the great work that you are doing and all of your colleagues across the medical profession, from you as a doctor to the nurses to the support staff at hospitals. I think we really have a true understanding, more people do, of how important you all are to the essential functioning of our country.
Very much appreciate that. Thank you.
Thank you, Dr. Cavanaugh, for being with us today.
So great information today. We hope it was for you as well. We thank you for tuning in, and we'll see you on the next episode of Vax Matters.